Welcome to the December 2009 edition of Outlook Video, your nationally recognized, award-winning show for gay, lesbian, bisexual, and transgender communities. I'm Brianna Gilbert.
And I'm Jay Raley. This month we honor World AIDS Day, observed every year on December 1st.
The World Health Organization established World AIDS Day in 1988 to provide governments, national AIDS programs, faith organizations, community organizations, and individuals with an opportunity to raise awareness and focus attention on the global AIDS epidemic.
Starting this month's show, I'm pleased to talk with Dr. Michael Harbour, a clinical associate professor at Stanford University School of Medicine. Along with his part-time work at the Stanford HIV Treatment Center, Dr. Harbour will draw from his many other roles to inform us about what's happening in the HIV treatment and which way the infection rates are trending.
Let's change our set and return for Jay's interview with Dr. Michael Harbour.
Dr. Michael Harbour joins us again this year to talk about HIV treatment and prevention. He is now an adjunct to Stanford University as well as an HIV medical director at Merck. Welcome, Dr. Harbour.
Hi, Jay. Thanks.
So, Dr. Harbour, what has happened in the last year since we've talked? What's the latest and greatest?
Well, there's always something new going on with HIV in terms of new research, medications that are coming out, and prevention techniques. One of the newest things that actually is being looked at right now is the earlier treatment for patients with HIV. We've often ascribed therapy to patients who T cells have been between 350 and 500 as an option, and now we are beginning to treat patients earlier to try to prevent the immune system from deteriorating. So that's new. Patients are going to get started on therapy a bit earlier than they had been in the past.
So previously they had just maybe like held off a little bit to see whether or not it really was HIV, or just thought that the opportune time was maybe after it got established a little bit. I find it's why would they want to wait? You know?
Right. So many people will. After the diagnosis is made, we often have waited to try to come to an agreement or a happy medium between potential toxicities associated with therapy, the costs associated with therapies, but also trying to prevent the immune system from deteriorating. And so we've been able to hone in on more specific times of when that's able to be done. And starting with anyone with a T cell before 500 seems to be or lower than 500 seems to be the time to do that.
So that is like as soon as it's recognized that you've gotten the HIV, then you start treatment right away would be
Some
the
people
ideal.
like to start therapy immediately, and then amongst older patients, and people are going to cringe when I say this, but patients older than age 40 are considered older in the general view for HIV-infected patients. They may want to start a bit earlier as well.
What about the cost of HIV? I mean, with the recession being what it is and cutbacks and everything else, I mean, how would a person, let's say, who doesn't have insurance, how would they get any kind of help from what's out there?
Yeah. If you don't have private health insurance, the federal government allocates money through the Ryan White program. He was the young boy who was afflicted with hemophilia, and the Congress set aside a program and money to dispense to states, and each state has their own Ryan White program. Under Ryan White is the ADAP program, the AIDS Drug Assistance Program, where monies are set aside for drugs. So depending upon what you may need, whether it just be drug therapy or actual healthcare therapy, you can patchwork a plan together. Congress has continued to fund these programs, thankfully, but the states also have to contribute their fair share to the federal program, kind of like matching funds for the highways program.
Right.
And many states are in financial distress, California included. California has had a lot of cutbacks, not in the ADAP program yet, but amongst HIV education and prevention programs, many of those have been cut. The budgets have been severely cut. So people wanting to get HIV testing in anonymous sites, those are being cut back. Monies are being cut back for early intervention programs as well.
That seems really unfortunate. Is the rates of infection, has that been changing over, or is that pretty steady right now?
The rates have been slowly increasing. Amongst the gay community, we did see a major drop-off. And then it's been a slow, steady increase. And I have to say, in my own personal experience in seeing patients, I see a lot of younger people still coming in with HIV. It's like somehow they've missed the message, unfortunately, and it's sad to have to see somebody.
It's like apathy.
Apathy, I think some people, just resolve the fact that if they are going to be around long enough, they're going to get exposed to it, so they don't always protect themselves. But also the education message is not being, given out early on like it should be.
Right. Now, what about the H1N1 virus in competition?
Right.
Now,
So the H1N1 virus, or the swine flu virus, as it's also known as, is a virus that's out in the communities now. It's different than the seasonal flu vaccine, and it can affect patients with HIV. So you can essentially get two different types of flus: the seasonal flu as well as the swine flu. There's a vaccine that's out. It's just coming into communities now, and it's recommended that HIV patients get the attenuated form of that vaccine, which is a shot form, not the intranasal form, which is a live virus vaccine. So you need to check with your doctor and the public health department about when those will be available. But HIV patients are at higher risk and need to have those vaccines. Right.
Well, I appreciate all the information. That's all the time, unfortunately, we have time for today. But hopefully we'll get to see you again next year. And one of these years, hopefully we'll get a cure. How about that?
That would be nice to talk about.
That would be great. Thanks again for joining us.
Thanks, Jay.